First thing you will do is screen your patient for COVID using the COVID screening form. You'll fill out their name, their date of birth, and run through the questions. Taking their temperature, getting close to their forehead but not actually touching it, 97.7. Continue to fill out the questionnaire, asking these yes or no questions, sign and date the back. If your patient has any concerning symptoms, grab a pharmacist or preceptor and we will evaluate from there. Fill out your patient information, ask them a series of questions. You will take their temperature and record it on number 3 where it says temperature today. Next, you'll review the form that the patient will fill out before they come to you. Review the front to make sure they don't have any alarming answers to the questions. On the back, please make sure that the patient has signed and dated the form. And on page 2, you'll want to make sure that it is fully filled out with the patient's information. Now we'll review the supplies that you'll need to give a flu shot. First, you'll need the syringe itself, a 1-inch needle that is 25 gauge, which will be packaged separately, an alcohol pad to sterilize the patient's arm, a Band-Aid for after the vaccine, and a gauze pad just in case. And of course, a sharps container close by for after the vaccine. First, you'll ask the patient which arm they would prefer, as the injection site may be sore following the immunization. Eric has chosen his left arm. Move the patient's sleeve out of the way and sterilize the surface. Start in the middle of the arm and move in a circular outward motion. While waiting for the alcohol to dry, attach your needle to your syringe. Again, a 25 gauge, 1-inch needle. Twisting firmly on in place. So when looking at the patient's arm, an IM injection goes in the deltoid, so look for the triangle at the top of the patient's arm. Or you can do the C technique, where placing your fingertips at the top of the person's shoulder and you'll go in the middle of the area, making sure that the patient's arm is nice and relaxed and there's no tension. Then, when it's time to inject, uncap, find your place, inject at a 90-degree angle, remove, safety your needle, and expose in the sharp container. Place Band-Aid over injection site. After administration, remind patient that their arm may become sore or swollen. Encourage patient to move arm and keep it fluid throughout the day. And if it becomes bothersome, they can take ibuprofen or Tylenol. At the conclusion of the appointment, make sure you fill out the bottom of the vaccine administration record, circling where the immunization was completed, the date it was administered, the vaccine that was given, the lot and expiration date, which arm was used, the size of the needle, your signature, your title.
Is the person to be vaccinated sick today? If the patient is sick before their vaccination, there's really no evidence that acute illness reduces the vaccine's efficacy or increases any adverse effects. If they are moderately or severely ill, they shouldn't be vaccinated until their symptoms improve. However, if they're minor illnesses, even if they do have a fever or if they do not, that doesn't contraindicate the flu vaccine. So don't withhold it in those situations, as well as even if a person is taking antibiotics, they can still get it. If the patient has any sort of allergy to a component of the vaccine, caution should be taken at that time. If they are allergic to potentially eggs, there is a vaccination available that is for patients that are allergic to eggs and has an egg-free recombinant as well. If they have an egg allergy and they've had severe symptoms, they should be getting their vaccination in either the health department or a physician's office. If a patient's had a serious reaction to the flu vaccine in the past, please ask them to identify what happened. And if these symptoms and these reactions were immediate, it's usually a contraindication to further vaccinate with the flu vaccination. However, common things like fever, muscle pain, other issues along those lines are most likely just to happen to people getting their first time vaccinations, very common, and should not be a concern at that time. Who should get the influenza vaccine? Everyone 6 months and older who does not have a contraindication to the vaccine should all be vaccinated for the flu. When should people be vaccinated? Health experts recommend that patients should be vaccinated by the end of October. For people that only need one dose, early vaccination like in July and August can result in reduced protection toward the end of the flu season, particularly for older adults. So we want to make sure that we have coverage all throughout the entire flu season. Why are different influenza vaccines available for adults 65 and older? Essentially, aging decreases the body's ability to develop a good immune response after getting the flu vaccine. To combat that, flu vaccine manufacturers have taken a different approach to improve that immune response, either with a large amount of antigen in the vaccine that gives older people a better immune response and better protection against the flu, or they include an adjuvant in their vaccine that helps improve the response to the vaccine. If a patient is undergoing cancer treatment, or if we have a pregnant patient, should they get the influenza vaccine? Actually, yeah. For both cases, if a patient has cancer, it's important to protect them as they are immunocompromised, as well as it's safe for the pregnant woman in order to protect her and her pregnancy. It's also recommended that a patient gets vaccinated for the flu even if they are breastfeeding as well. Is this vaccine safe? It's a question we hear quite often in the pharmacy from people that may be skeptical, that may be a little bit nervous about vaccines. Make sure each patient knows the influenza vaccine is very safe. Make sure we also counsel on the major side effects or the most common side effects with this flu vaccine, which is usually soreness, stiffness in the arm, and maybe some redness and some swelling at the site of injection. However, these reactions are temporary and they occur in roughly 15 to 20% of our patients. So making sure that it's a common thing, but also making sure that they know that it's something that will go away quickly. Less than 1% of vaccine patients will develop symptoms like a fever or chills or muscle aches for 1 to 2 days. This does not mean they have the flu, it just is a side effect that comes around, maybe not as often. How effective is the flu vaccine? Maybe another question that we might hear quite often, but the answer is that it really just depends. Protection from the flu vaccine varies by the similarity of the vaccine strand. As we know, each year with antigenic drift or antigenic shift, we might have differences in our flu vaccine that we may not have realized, or a different strand that we didn't have last year. So with our vaccines, we just try to take essentially an educated guess on what our strands will be and what we can put in the vaccine to cover for those. If the match between the strand that is currently going on in the flu season and the strand in the vaccine are close or they match, then it usually is about 50 to 70% effective in preventing the flu in healthy people less than 65. Can the vaccine cause the flu? One of the major questions that we might get as well. No, neither the injectable or the nasal spray vaccine can indeed cause the flu. The inactivated, or the most common one, the one that is not live, only contains killed virus fragments, and the recombinant vaccine contains only part of the influenza virus. So neither type of vaccine can cause influenza